So the thing what I wanted to show is the amazing things that we can do with porcelain veneers. So this patient came in unhappy with their smile and really focused on the front four teeth out of the front six in their smile window. Her complaint was that the old tooth colored fillings were starting to stain and wear, didn't have the smile that she felt she deserved. So what she did, she came in, very first appointment. We took some impressions, digital scans. My lab technician and I sat down and designed out kind of the perfect smile, what we wanted these teeth to look like. So the next step was bringing the patient back, sitting down and showing her the model and showing her, hey, this is exactly where I can take your teeth. So your smile looks like this now, and we can get to this point. So once she was on board, she said everything looked great. The next appointment was the preparation appointment. So she came in. I got her numb so she didn't feel anything in this area of the mouth. Removed just a little bit of tooth structure, and that's probably a big advantage of veneers over something more invasive like crowns. Is that they're really think of them like a press-on nail. They're just a porcelain jacket. I remove about a third to a half a millimeter of tooth structure all the way around off the front side and all the way up the chewing surface to leave kind of a modified, a little bit smaller shaped tooth. I would make our final impression, and then I make a nice set of temporary provisionals that we bond on the tooth that look just like the final ones, but they're made out of a temporary material. And this does two things. Number one, it protects those teeth while it takes my lab about 4 weeks to make the final veneers, but it also lets us test drive the shape and the anatomy of what we kind of design on the wax. So we know that if we didn't get it perfect and we want to make a little tweak or change, a lab technician knows exactly what changes to make. So after 4 weeks, the patient comes back. Sometimes we have to get you numb again. Sometimes we don't. We take the temporaries off and we individually see each one of these four porcelain veneers on the teeth. So after these are bonded in place, you can floss between the teeth. You can brush between the teeth. There's very little sensitivity, if any, after the procedure because everything is sealed off and bonded and closed off. And as far as eating restriction goes, they're actually stronger than what she came in with this tooth colored filling material bonded to the front. Once these porcelain veneers are bonded into place, they're really strong. You can eat apples, you can eat korma cob, pretty much any foods that you want to eat. So I love doing veneers. We do a lot of veneers here. The results are fantastic, and it's very minimal tooth production.